Thank you. So let me call the Gloucester Board of Health meeting of Thursday, July 13th, 2023 to order. It is approximately 5:30 and we are in the Harbor Masters Conference Room. I should mention that as recent amendments to the open meeting law allows, the Board of Health will continue to hold its meetings remotely. So this is a hybrid meeting. But adequate alternative access to the meeting is provided through the Zoom link, which people should be aware of. First, we have a full house, so to speak, tonight, but I think it's worthwhile, since we have some new members to the staff, to go around and introduce the board members and the health department staff. So Marco, if you could start. Joe Rosa, Board of Health.
John Random, Board of Health member.
Eric.
Eric Kaplan, Board of Health member.
Good. And now if we could start going around the room, wherever. How about you, Chelsea?
Hi, Chelsea Goldstein Walsh, Prevention Director.
Dan Weaver, Prevention Coordinator.
David Tucker, Youth Development Coordinator.
Cindy Junker, Public Health Nurse.
Bree Gray, Health Inspector.
Leslie Whalen, sanitarian.
Jacob Taylor, Food and Health Inspector.
Leo Leary, Financial Specialist with Health Department.
Jean Master, graduate student.
Patrick Warren, undergraduate student.
Thank you all. Next on the agenda is public oral communication. That's an opportunity for the public to speak on an item not on the agenda for up to 3 minutes. Is there anyone?
We currently have no attendees.
No hands raised. So the next item on the agenda is the approval of the June 1st meeting minutes.
I move that we accept the minutes of the June 1st meeting.
I will abstain since I wasn't at that meeting. So we have three people who were at the meeting.
I'll second. Seconded.
Don seconds. Any discussion, changes? So the motion on the floor to accept the minutes as written. All in favor?
Eric, aye.
Marco? Aye.
Yep, John.
Okay. The meetings are accepted as written. Next item on the agenda are the committee reports. Those of you that have an agenda in front of you, why don't we just go around on the basis of the agenda? Food safety, Jake, you're first.
In the month of June, we had 9 complaints, 53 inspections, 5 re-inspections due to violations, and 8 events. We had 1 case of Vibrio, which of course came in on Fiesta Friday. So in the midst of running around for Fiesta, had to go and do that. I think I saw you that day. I assisted Chelsea in the prevention department with hanging posters for their youth events and whatnot. SEAC meetings, we had the Magnolia Farmers Market officially began. We had the Maritime Center had their sea shanty get together with food vendors and whatnot. We had the Juneteenth 2nd annual celebration at City Hall. We had the Annisquam Farmers Market. We had the first ever Magnolia Block Party. And then we had the town's biggest event, the St. Peter's Fiesta, every day, starting on Thursday with the electrical, the building inspector. We had to go around to every establishment in town just to set capacity limits and check the general safety. And then from Friday, Saturday, Sunday, Monday, you had to be at St. Peter's Square by 6:30, 7 a.m. Make sure the dumpsters were all empty, the porta potties were clean, the St. Peter's Fiesta Committee cleaned the bandstand, the entire parking lot and whatnot. Had to meet with the DPW to make sure that all the trash was removed and all the bottles and all the urine and all the fun Fiesta things off of the beach, Rogers Street, Main Street, Fort neighborhood, and all around. It's been a very busy couple of weeks.
Thank you, Jake. All of the staff works very hard. Hopefully everyone in the public and the rest of the board realizes that. But this month is especially intensive for the food inspector. So kudos to you, Jake.
Thank you, sir.
Hopefully you're getting some rest these days.
October's around the corner.
Leslie.
In your packet, I put a list of activities as well as minutes from the septic subcommittee meeting for May. So if anyone had any questions on any of that. What? So to my reports.
All right, in June, we did 13 rental units. We did 9 hotel motels, responded to around 8 complaints. It's also time for pool and camp, so finished up 5 pool inspections. We did 7 out of the 8 camps for the summer. And I went around with the building department for 16 annual / periodic facility inspections. And then we've also been doing regular weekly beach testing, which has been going pretty well so far. So that's been good. And we have our 2 interns with us this summer. So they've been working on quite a lot of projects and they've been a really great asset to the department. So we're very happy to have them.
Can I ask a question to Leslie? I'm sorry, Leslie, I didn't know the environmental pollution, like the Good Harbor Creek, is that goes under your review? So it says environmental pollution under your report.
So the reason I put that on is we had a presentation
Yep,
and I was participating in
Okay.
the preparation of
okay.
that.
No, the reason I ask is because it's closed again now, right?
No, it's open.
It's open? I thought they closed.
No, it's slow.
Okay, all right.
I heard that,
And it had-
so it already started spreading, so
Oh,
it
wow.
hasn't happened
Yeah,
yet.
yeah, okay.
no,
Oh,
no,
very
no,
good.
hasn't
Okay, all right, good.
Cindy?
Thank you. So I have given reports to the board regarding my vaccine clinics and my communicable diseases. Yes, I worked with Jake on quite a few foodborne illnesses at inopportune times for him, but thank you, Jake. I worked on camp inspections with Bree, and they were all very successful and fun little field trips. And I continue to handle all of my daily and weekly duties. We are the North Shore Mothers Visiting Partnership is reconvening and we have signed the memorandum of agreement and we'll be starting probably in August. So that's it for me.
Chelsea.
Well, first of all, we hired 2 new members of the prevention team. I know you guys already introduced yourself, but if you want to just share a little bit, I said I'd give an opportunity for you guys to kind of introduce yourselves if you want to reintroduce yourself and share any information that you'd like.
Danielle, you want to take it first?
Okay, well, I'm happy to be joining the Gloucester Health Department as the prevention coordinator. And I look forward to working with everyone in the department. My main area is a grant called Partnerships for Success. And the focus is to prevent and reduce use of alcohol, marijuana, and vaping among youth ages 9 to 20. So that's the project.
And this is Dan's first week on the job
Yes.
and David's second week.
Yes. It was very lonely the first week, because alone, but it was fun.
Welcome, guys.
Good.
Thank you.
And I'm David Tucker, as I previously stated. I worked for the Y for about 10 years and have worked with kids my whole life, whether it was a CIT, camper, or anything. So I got to learn about the amazing community, lived here my whole life. So I'm excited to help the youth and do anything we can to prevent and assist in any way possible. These kids need it, and I'm excited to be here.
Great, thank you.
And I'm very excited to have you both.
I'm very excited to be with you. So really,
So beyond keeping them busy and onboarding both David and Dan this week, and David onboarded himself last week because I was away on vacation. We, during the month of June, had a lot of events as well. We had our North Shore Teen Summer Send-Off regional event on June 17th, which was a really great success despite the heavy rain. We had about 50 teens attend from Gloucester, Beverly, Danvers, Ipswich, and Salem. And most kids stayed for the duration of the 3-hour event. So we're really excited, and that will be an annual event. Patrick and Janine have a great idea to table on behalf of the Gloucester Health Department at North Shore Pride in Salem on June 24th. So the three of us went to represent the Gloucester Health Department. We distributed a ton of resources and materials around sun safety, tick safety, mental health, substance use prevention, and we really reached probably hundreds of people. So that was a really great event. So thank you both for all your hard work on that. Beyond that, we continue our partnership with Cape Ann Art Haven to offer free classes over the summer every Monday at Riverdale Community Center. That's open to anyone for children. We are partnering with Magma to offer free capoeira classes also at Riverdale Community Center every Sunday morning at 10. So anybody is welcome to go and either watch and or hopefully participate. And that is also running throughout the summer. Again, Janine and Patrick have been working really hard and helping our team on a lot of different projects, including looking at some of the youth risk behavior survey data. Janine is specializing in epidemiology for your graduate program, and so you're crunching a lot of numbers for us, which is really appreciated and will be used potentially to do a positive community norms campaign around youth substance use in Gloucester. And lastly, also in June, myself and 5 other coalition members attended the Montana Summer Institute from June 20th to 23rd to learn about positive community norms and how to use the science of the positive in substance use prevention work. So the group that went is going to debrief and present to the larger coalition at an upcoming coalition meeting so that we can share what we learned with the entire coalition. And lastly, I know Rosalie Nicastro is not here right now, but she is continuing to work with the Council on Aging to support the Seniors on the Go bus moving forward at a reduced cost, but the city has adopted that program into the city budget for the fiscal year 2024, and we'll be continuing to provide trips for seniors. So Rosalie is working closely with Elise and Natalia at the Council on Aging to continue that service. And that's it.
Thank you.
Very good. Thank you. No other comments, I presume. The next item on the agenda is a public hearing to discuss and vote on the tobacco policy changes necessitated largely by changes in state law, which most pointedly greatly increase fines to minimize the possibility of youth being able to access tobacco products. Thanks to Joyce Redford, we have a revised version of those regulations, which incorporate the state laws and also attempt to, because of the board's action, attempt to minimize the possibility of a shop losing its license for reasons not connected to them selling to minors, but perhaps changes in ownership. We don't want, especially for the convenience shops in town, we don't want them to go out of business just because of our failure to make it possible for people to change ownership of their shops. So all of this is possible because of Joyce Redford's efforts. And Joyce, if you would like to walk us through what is proposed. After that, we will have an opportunity for the public to speak to those regulations. And thereafter, we will have a discussion on the board and vote to accept or not the regulations. Joyce.
Good evening, everybody. I believe you have the copy with the highlights of the changes that were beyond state law or just updates. And I believe the first place that starts is on page 9.
Yep.
So we reduced the permit cap to 33, just based on attrition. And that is section 8A. So that's a new number, but it still exceeds the number we have active. We also, part of your concern actually, Joe, was the specific language around transfer of ownership. And we exceeded that on sale of business, which is section 9B, to 90 days versus 30 days. Retail density is just to try and prevent too many retailers too close to each other. That's retail density 10. And retailers like that. They just don't like having another retailer right next door to be their competition generally. Any new permits won't be opened close to 1,000. I'm on section B, 1,000 feet from an existing retailer with a valid tobacco permit. And then prohibiting smoking bars is just to make that particular language explicit. It wasn't explicit, but it's been in effect since you did ETS regulations like in the early 2000s. It just made no exception for smoking bars, and that was enough. But we just felt like it was important to explicitly state that that was occurring. The next change, and this one is, I guess, this is state law minimal, so it's page 12. And it's a 1,000 for first violation with a 3-day suspension if that first violation is a sale to a minor. $2,000 fine for a second violation within 36 months. So we call that a tolling period. If a sale occurs or a violation occurs, we look back 36 months and see where they are in the tolling period. And that would be a $2,000 fine, which is minimum. That's the minimum standard with state law. And a 7-day suspension, which was in your language prior to the state law coming into effect. If it was a violation, I'm just going to jump back for a second. If the violation were something other than a sale to a minor, like they had a flavored product they weren't supposed to have, or humidor unlocked, or any number of the other components of the regulation, there'd be just a $1,000 fine, no suspension. The suspension on the first violation is only when there's a sale to a minor, and that is state law. They just wanted the boards of health to pick the time frame. So we agreed to the 3-day suspension. And then in the case of a third violation within 36 months, it jumps to $5,000 and a 30-day suspension. And if you should have somebody who was really egregious, the board always has the opportunity. It states that in part 2 that you shall have a hearing and you have the opportunity to revoke if that's what you choose to do. We have never gotten there, and on my 25 years in Gloucester, no one's been that egregious, thankfully. Unfortunately, we have had some bad actors out there in some of the other 15 municipalities. If you intend to suspend, this is not, it's just a little bit more clearly defined. It was in state law, just what happens if there is a suspension, and that all fines will be paid. So those are the newest things, or the most updated. The fines will now, there were 3 components that of your local regulation that were not captured in the state law, and that was cigars, the minimal cigar pricing and packaging. And that's predominantly because they used to be cheap, sweet, and easy to get, and youth would get them. They were flavored. They were like 4 for 99 cents. So in 2016, I believe, the Gloucester Board of Health did the minimal cigar pricing and packaging. 1 single cigar or cigarello would be $2.50, no less, $2.50 or more, but no less. And 2 or more would be $5. So 2, 3, 5, 20, because those are the numbers they're sold in. And that hasn't changed, but it's now being captured not with a 21D ticket, but following, this regulation will follow all the state laws. Also, the other component was educational institutes. I don't believe there's a college, there's no higher education in Gloucester, but an example would be if, you know, you had like a Salem State and they had a bookstore, tobacco can't be being sold in there. And most of those locations across the state have self-imposed this. They just don't sell tobacco. They haven't for years and years. And the third thing is blunt wraps. The blunt wraps that, you know, you roll, they're sometimes used for tobacco, but often used for cannabis. That is a local regulation. All of our collaborative members, the 15 other municipalities have that same language. It just wraps the finding into this one regulation. And just so the board knows, Danvers, Peabody, Salem is proposing, Rockport is proposing. You have the language where you're putting all the fines into one regulation to streamline that everything under this regulation falls under that finding structure. Two other things I have before we move forward, because I'm not sure if you want to vote on it as like amended language, but on page 6, rolling papers, I ended up in the draft leaving the note. So if you go to page 6, you'll see what I'm talking about. There's like a block that says note, which should be removed. So after roll your own machine, it says note. The decision is already made, so that doesn't need to stay in there. And then on page 7, sorry, page 7, where it repeatedly says smoking bar, in A. Wait a minute, I'm on, we can go back to page, oh no, 7, I'm right. So A, where it talks about adult only establishments and smoking bars. We don't have, if we're prohibiting smoking bars, there's no reason for that language to stay in. So I just want to nix the smoking bar, leave the adult only establishment and remove, not even have it in the regulation. Because if someone was reading the regulation and it consistently says, you know, you need to have signs in your smoking bar and you need to do this in your smoking bar, and on one of the pages before it says they're not permitted, I just want to have them removed. So it's that language in A, and then under C, that whole paragraph will be removed because we don't allow for smoking bars. And then in jumping back to A5, except in the case of smoking bars, it says notice to consume the sale of flavors. We're going to take that out because there won't be any smoking bars in Gloucester.
Where was that, Joyce? The last thing?
Page 7A.
A, okay.
And if you go through, because that's quite a long, but it's Roman numerals. So if you go to like the 7th line, it says and 5, you know, it's in parentheses, it's the V, except in the case of smoking bars, notice to consumers that, and it continues, but there won't be a smoking bar. So I'll remove that 5.
Yep.
Joyce, I wanted to thank you for doing all this hard work over these many months.
Thank you.
I've read the regulations about 5 times, including again today, and it's amazing. And I really appreciate all the work you've done.
Thank you. And I will say, we start with a template, and the reason for that is to keep consistency across the state, but then the boards of health certainly have their ability to add or subtract and do more than the state. And that's where I come in. That's my job, to help you guys get through that process. So thank you.
Thank you, Joyce. So does the board, anyone on the board have any questions about the regulations as they are to be written with the amendments that Joyce has just outlined? No? We can then
There are no attendees.
No attendees.
Oh,
Interesting.
Joe, I think I reminded the board, it is not uncommon.
Yeah,
Beverly did the same thing, Peabody did the same thing, no one, they're just not that big a change for the retailers.
so, but I do think that there is a big change in terms of the fine, the level of the fines. The level of the fines is big time for a small business. $1,000 the first go, that's not small change.
But
And
that's
so-
state law.
Yeah, no, absolutely, and I don't disagree with it. All I'm saying, all I'm about to ask is whether or not we have informed all of the 30 or so permittees that is the level of fine.
Public notice was in the paper. It was checked. Was there on Wednesday after the holiday, July the
So
5th.
did it explicitly say what the level of the fines are? Or is it just-
It didn't say, it mentioned fines within the
So I
public
think it would
notice.
be a good idea for us to draft at some point, not at this meeting, for us to just simply draft a letter to send to all the permittees. That.
Joe, if I may,
Sorry.
when these went into effect in 2020, so
Yep.
they've been, the state fines have been in effect since 2020.
Yep,
And we've been enforcing at that level since 2020. And prior to the state law going into effect, all retailers were notified of the fine changes.
so they should already know about this.
Yes, they are completely aware. And when we do inspections, the signage we give them, which they've had for 3 years now, actually, that's the one thing I point out on a summary is like, don't forget the fines are higher now, 1,000, 2,000, 5,000.
Right.
So just so you know, they certainly are aware of the changes in the state law.
Okay, good, thank you, Joyce.
You're welcome.
And let me echo Eric's comments that thank you very much for all the work you've done on this. It's not something that we would want to tackle ourselves, and very much appreciate it. Any other comments, questions from the board? If there is no one wishing to speak from the public, Don has made a motion to approve as edited by Joyce. Seconded by Marco. Any further discussion, Eric?
No.
Any discussion? No?
No.
Vote, Eric?
Eric, aye.
Marco, aye. Joe Rosa, aye.
John Gavin, aye.
So approved.
Joyce.
Joyce, thank you very much.
You just have to pick an enactment date.
What date?
An enactment date, active as of,
September 1st? Is that okay? That too soon?
No, it's fine. You can
September
even do, I mean, you could do, what are we in July, August? Yeah, I mean, September 1st is fine.
okay.
Coincides with the start of the school year. I don't know.
Yeah. That's fine with me. We all agree that that's reasonable.
Thank you so much.
You're welcome. Thank you, guys. And I'll send you that amended copy tomorrow, Lee, with the enactment date.
Great. Thank you
Thank
very
you
much.
all.
Thanks, Joyce.
Wait,
Good night.
The next item on the agenda is some new business regarding beach signage. I think we're getting close to, who's gonna speak to that? Bree, are you gonna speak?
Jake, I left
Jake.
it up to the beach testing team.
So we ordered the signage and everything. There should be copies of it within your packets.
Yeah.
Spoke with the DPW yesterday. The DPW has the signs and the poles, and we just need to turn around and basically find out where we want them to be put. Over last week and everything, went around to copies of different things I showed you the other day during the team meeting and whatnot. Basically, it's just all signs and posts that are available in front of the beach frontage of all the public beaches right now. So a lot of those are just overcrowded, and everything was already in the budget to provide our own poles and whatnot. So over the course of the next week or two, Bree and I, during the beach testing, We'll go around, just try to find locations. A lot of the beaches like Pavilion and whatnot, you access through the Boulevard, Beach Court, over in the Ford Neighborhood Chamber of Commerce parking lot. So basically, over the course of this week, now that we have them, trying to figure out accurate places to actually put them so the citizens can actually view them upon their entries.
And there would be a clear distinction between, for instance, Good Harbor Creek and Good Harbor Beach.
Oh, yeah, yes, sir. So basically, the way we want to begin, like we spoke about in the team meeting yesterday, the two problem factors that we had last year with Pavilion Beach and Good Harbor Creek. So obviously, that's where we'll begin and task the DPW with installing the signposts, so then we can turn around, put the signs up ourselves and whatnot.
Good, terrific.
Step by step.
Any other questions on that issue?
Beaches up and down the North Shore have been closed.
Oh, it's been the whole
And we-
state,
we've-
yeah.
We've not so far avoided that. It's unbelievable, I know.
It was
Yeah.
50. Yeah, 50 beaches.
That's pretty wild. Yeah,
Yeah.
front page news on the Channel 7 the other day and everything like that. So knock on wood, we're all good this season so far.
Good. Any concerns of the board? Marco?
I think we're doing better than most places.
Yeah, that's true. Hard work. Anything else? Motion to adjourn?
I move that we adjourn.
Second. All in favor? Well. Not bad.
Good meeting.
I think that was a record.
Yeah, here.
Thought I was gonna for a few minutes, but my call.
It's still.
Thank you, everybody.
Eric, on Tuesday, are you likely to be able to zoom into the directors?
I'll try. I'm in magnificent Maine, but I'm leaving
As long as they
tomorrow.
have internet there.
I should be back.
I think they got it last year.
Hey, wait a minute.
Thank you, everybody.
I know.
Night, everybody.